am Dr. Purnendu Kumar Behera, Senior Consultant, Department of Medicine, High Tech Medical College, with specialization in diabetes. So here I want to tell about diabetes mellitus, which is very common in the locality now. When I start, the time is short, so within very few minutes I will try to complete entire management of diabetes. So if you think of diabetes, what is the definition, it will come to the mind. First is, it is a metabolic disease of carbohydrate, fat and protein metabolism, leading to the hyperglycemia with glycosuria, having blood sugar that is, first thing is 80 to 120 and postprandial is above up to 150 millimeter deciliter of blood. With this background, we will proceed. After the definition, we will proceed. What is the classification of diabetes? How do you classify? If you classify the diabetes, the type 1 diabetes, where there is no production of insulin and to control the hyperglycemia. And second one is type 2 diabetes, where there is no utilization for as a result of which hyperglycemia is not reduced, blood sugar is not reduced. And last but not the least, GDM. GDM is gestational diabetes mellitus. So these are the three things: type 1 diabetes, type 2 diabetes, type 3 diabetes. Not type 3, that is GDM. GDM means gestational diabetes mellitus. When the pregnant lady comes to the doctor after the 24 weeks, and if we find by diabetes blood sugar is high, we brand it to be GDM. But if the pregnant lady will come in the first trimester with diabetes, we brand it to be type 1 diabetes, but not GDM. After this, knowing very well about the classification, we will proceed. When a patient will come to you, with what symptoms the patient will come to you? Usually the patient comes to you, there are so for the symptoms is concerned, there is a typical symptoms and there is a atypical symptoms. Typical symptoms are polyuria, bahutara parisra habo, polydipsia, bahut shoso habo, and polyphagia, bahut bhoko habo. Polyuria, polydipsia and polyphagia. This is the typical symptoms of diabetes mellitus. But if we go for the atypical manifestation of diabetes, atypical symptoms are unexplained weight loss. Unexplained weight loss, we will not find why the patient will come to us with the complaint of the mate mor ojan kami jauchi maase bhitare 10 kg kami galani. Unexplained weight loss, unhealed ulcer, jetebale ulcer gote achi se ulcer ta heal honi, then with that condition the patient will come. And number 3 is balanoprostatitis. Balanoprostatitis is the prepuce, there is phimosis of the prepuce or the infection of the prepuce, so that the preputial skin will not be retracted. So that is called balanoprostatitis. Number 3 is sudden onset of blindness. The patient will come to you with sudden onset of blindness because of the rupture of the retina. And last but not least, macrosomia. You sit in the obstetric gynecology department, a patient we are seeing that the period of amenorrhea is not corresponding with height of uterus. Height of uterus is more. If height of uterus is more, then you suspect it is a case of macrosomia. If macrosomia is there, you see blood sugar will be high. So the 5 atypical manifestations everybody should remember: unexplained weight loss, unhealed ulcer, balanoposthitis, macrosomia, and sudden onset of blindness. These are the only missed at time when you sit in the clinics. So with these symptoms, let's go. What are the signs we will get? The signs, as you know, we will find in different parts. As for the complications of diabetes, the patient will come to you with numbness of the limbs. Numbness of the limbs, that is a peripheral neuropathy, which occurs in the day 1. And number 2, the patient will come with suppression of urination, that is because of the affection of the renal symptom, that affects about 11 years. And patient will come to you with blurring of vision or sudden blindness, and which affects usually in diabetes after 5 years. And patient will come to you with high blood pressure. When you see the blood pressure, the cardiovascular system, you examine high blood pressure, and there is also there will be some ECG finding. And at times, so far the central nervous system is concerned, patient may come with stroke. With these signs, we will proceed. What investigation you will do? Investigation you will do is, first is fasting blood sugar, then postprandial PPBS after 2 hours, then HbA1c, that is chelated hemoglobin, HbA1c. Apart from that, you will do the lipid profiles, urea, creatinine, extra chest. Why extra chest? Because extra chest, you see 6% of association is there with tuberculosis in diabetic mellitus. Then ECG. With this investigation, we will go proceed for the management. After that, we clean the diagnosis of diabetes. If you see the diabetes, then we will proceed for the management. The management, you see, there are 3 types of managements. It is non-pharmacological management, then pharmacological management, and then insulin. So in this way, very shortly I am telling, so far the concern non-pharmacological management is, first is, number 1 is the diet, dash again to stop the hypertension, dash. Then your exercise. You see, exercise has got a dose. First month you must go, walking is the best exercise. Hatta hole ki jibe, hatta hole ki asibe for 20 minutes, not more than 20 minutes, one should not do the exercise. So first month 1 kilometer, second month 2 kilometers, third month 3 kilometers if possible, but 2 kilometers should be more than 20 minutes, it should not be done. Number 3 is your obesity. Obesity you can control by the BMI, body mass index. Then one must be very much acquainted with alcohol, and last but not the least is smoking. Smoking should be stopped, and alcohol they should advise for the male patient 30 ml 1 ounce, and for the female patient half an ounce. So with this non-pharmacological management is completed. Then you switch over to the oral hypoglycemia, OHA. OHA is there are several drugs, but main drugs they usually commonly used drugs are the sulfonylurea, biguanides, and the gliptins. Now newly advised gliptins. So you start this for 8 weeks. For sulfonylurea 4 weeks. If there is no response, you add biguanides, that is metformin, for another 4 weeks. It comes to 8 weeks. After 8 weeks, if the patient is not responding, you tell that it is a case of OHA failure. OHA failure is then one must switch over to insulin. Before insulin, you may try with the glucagones, that is pioglitazone and rosiglitazone. If it is not responding, then immediately switch over to insulin. So now naturally the indication of insulin question will come. What is the indication of insulin? Insulin is classifications are there: clinical classification and biochemical classification. Clinical classification indication of insulin: type 1 diabetes, type 2 diabetes with OH failure, and number 3 is GDM. These are the clinical indications of diabetes mellitus. So far the insulin is concerned. The second time you will go for the biochemical. Biochemical, as I told you, the indication of insulin is fasting blood sugar. Please remember, more than 250 insulin is a must. Postprandial insulin more than 300 is a must, and HbA1c more than 10% insulin is a must. So in this way we must, and dose of insulin, you go to the doctor and he will advise you proper dose. With this you will definitely be benefited. Thank you.